For this project, I decided to learn more about Turner syndrome. Turner syndrome is directly linked to females and occurs when they are missing a partial or complete second sex chromosome. This missing genetic material or partial genetic material inhibits the female body from developing and maturing naturally. Some facial differences noticed are downturning eyelids, low set and prominent ears, small jaw, a high and narrow roof of mouth, neck webbing, a short stature, delayed puberty, reduced fertility, lymphedema, turned up nails, and short roots of the teeth. Within this genogram, we can see that the females are pink and the males are blue. You can see that none of them have Turner syndrome except for Annika, the patient. This is because the link is not genetic. There is no direct link from parents to child with Turner syndrome, so parents have no control if their baby develops TS. Medical conditions linked to TS includes chronic middle ear infections, hearing loss, distinctive heart, liver, and kidney abnormalities, autoimmune disorders, difficulty with nonverbal communication skills, spatial relationships, and executive functions. There may be some learning differences to prepare for that can be helped while going to school. Parents of a child with TS can prepare by communicating with teachers, encouraging their participation, and arranging a comfortable home. These steps can improve her mental health and abilities. If there is suspicion of a female having Turner syndrome, the care provider would perform a genetic blood test called karyotype. Additional genetic tests can be performed if a form of TS is strongly suspected but not confirmed from the standard karyotype test. Some care providers may also take a skin cell or cheek swab as a secondary test. Turner syndrome can even be known before giving birth with a test called the maternal serum screening. This is done by taking a sample of the amniotic fluid or other fetal tissue. These tests are not perfectly dependable, so a secondary examination is needed after birth. Here are my references.